and good morning, dear viewers. You're most welcome to the Daktari Show, and this is a health educative show which airs here on West Nile TV every Thursday from 10 a.m. to 11 a.m. You can get our content on Start Times 477. You can get us on Zuko 0073. You can get our content on YouTube, Facebook, and Twitter. And this is always your host, Sunday Junior Tom. And of recent, we have seen a study which was carried out in Uganda. In a study of 135 children, they found 35 children to be having sleep disorders, and this accounted to around the 27% of these children to be having these sleep pattern disorders. And when we talk about sleep disorders, some people may just think maybe I'm not sleeping enough hours or less hours, yet sleep itself has more than just sleeping of those few or enough hours. So with us today we have Mr. Jalot Simon, who is going to take us through what sleep is, who is going to take us through the sleep disorders, and who will take us through those various types. After taking us through the various types, he'll take us through the preventive measures and educate us or the viewers on how to have well-patterned and adequate sleep. You're most welcome to the Daktari Show, Mr. Jalot Simon. You can introduce yourself to the viewers.
Okay, thank you so much. It's a privilege to be here. Thank you so much to the host, West Nile TV, and Sunday Junior Tom, the moderator. It's a privilege. To dear viewers, I would like to wish you a good morning. My name is Simon Jalot, practicing nurse at Rural Regional Referral. Recently, I've just concluded my bachelor's degree in nursing science from Muni University. Been practicing now beyond Rural, also in other areas. And I believe more of the introductions, if there is need, we may have it maybe after the show. Thank you so much. Back to you, moderator.
All right. Thank you to Mr. Simon for giving in your time to come and educate the viewers of West Nile TV.
Thank you.
We know you're a man of busy schedule, so you giving in your time to come and educate the viewers. We don't take it for granted. Yes. So let's speak on, sir. What sleep disorders? Maybe even before we go into sleep disorders, what is sleep itself? Because people may look at it as something just mere.
Yeah, thank you so much for diving into that one. Because even if you ask what is sleep disorders, you still want to understand what sleep is. Yeah. And Mr. Moderator and the viewers, sleep is very simple to the extent that everyone, even if you went to a child, they will basically tell you what sleep is. And the major importance here now of this is the physiological changes which take place, the functional changes which take place, and so on, which during sleep. And that's vital. And if we're speaking about sleep, basically based on those changes to bring out the concept of sleep. Sleep is just a period of complete or minimal activity of the body, reduced body activity, with most of the functionality of the body cut off, and it's vital. So in simple time, most of the individuals will basically say that it's a period of which the body recovers up. It's a period of recovery of the body. So if you speak about sleep, you will be very important. So if you went to sleep order, we need to understand that sleep, as we have seen it, is a period of recovery of the body. We would also like to see its importance a little. There are a series of importances which sleep entail, and to the viewers, that's what will also guide you in paying attention to this very nice discussion. And it will also guide you on making decisions, more so in the community there where you will be having a lot of it. This is a very common thing. Things related to sleep, though most of the people take it as something which is just simple because they don't understand them, but it is more so we can call it something which can lead to very many other issues. So you'll find out that one of the advantages or the general advantage of sleep is that since it's a period of recovery, like Mr. Moderator, if we speak about recovery, you take an example of your phone. You charge your phone to 100%. You use it up. Then by the end of the day, the battery has gone off, and you need to recharge it. Just take that up, chance or that instance when you wake up in the morning and you stretch up your body very nicely and you feel, wow, I am refreshed. So that's what you realize if you feel that recovery may be very hard. That's actually what you need. If you have enough sleep, very, very good, when you wake up in the morning and have very charming experience. So you find out that a lot of things take place when you are sleeping. The body harmonizes itself. There is a regulation of hormonal imbalances. Hormones are just those are the chemicals which are in the body, which direct or drive up given body characteristics. And the rest, there are very many other chemicals which are in the body which need to be regulated. And the time of sleep, of rest, is the time when the cells, the body cells, the tissues and the organs actually get time to rehabilitate themselves, to rejuvenate, to regenerate, to the memory, even the brain, the memory gets reconsolidated. So it's very, very vital for you to have enough rest, enough sleep. And if you speak about enough sleep, the National Sleep Foundation recommends that the average time for adequate sleep is 7 to 9 hours. So if you set up your alarm at 10 p.m. by 5, if you woke up, it's fine. So that one you will have covered averagely 7 hours of sleep. That's very vital. So you find out that also on the advice of sleep, if you have enough sleep, you will find that even cases, people having hypertensive cases, people having diabetic cases, like currently I've carried out a research in Arua Regional Referral Hospital here, trying to ascertain up trying to carry out a given study on diabetic patients here, but the interactions they are bringing, there are very many diabetic patients here which they actually need a lot of education with regards to sleep, and some of them say that I don't have enough sleep because of this, because of this, because of. Then I say, hey, what about your management of diabetes and so on, which is also very vital, as we shall see as we continue up with this. So it's very important for us to understand sleep, because if you realize as we shall see the physiological changes which occur in the various sleep disorders, we shall also appreciate the fact that lack of sleep can increase up the chances of poor management of medical conditions like hypertension, diabetes and so on, because your body, you are leaving it at constant high activity, and you will need it. You don't give it time to rehabilitate. Maybe that's what we could have very briefly about sleep itself.
Yes. So now we're gonna on the sleep disorders. Yes. What are sleep disorders?
Yeah, thank you so much, moderator. Now, having understood what sleep is and its importance, as dear viewers, I want you to also understand sleep disorders. Sleep disorders are just a group of conditions that impair or that interrupt your sleep patterns. Could be interrupting the quality of your sleep, could be interrupting the duration of your sleep, or even the timing of your sleep. Those are sleep disorders. And maybe you are used to waking up at a given time, but all of a sudden you cannot maintain up your sleep, or all of a sudden you are feeling like you need to go to sleep every time. All of a sudden your sleep is not as nice as you have been. That's now the quality. So those are all a completion of all these, or any of those is what we shall call a disorder. And very importantly, we shall categorize that as a disorder in case it is persistent, because we realize that all what we are going to speak about, at least in lifetime, everyone has experienced, but it becomes significant in case it is persistent, what we call chronic. And of course, once is significant like that, it means that it is able to cause up health burdens, reducing your productivity, your time which you would have done some other things. So that's why we are seeing this discussion space is very important. So that's all about sleep disorders.
Okay. Yeah, thank you very much, sir. Like you've said, just these are disturbances in the sleep pattern an individual can be having. Yeah, so now a viewer may be asking, which things can they be doing outside? They are out of their knowledge, which they couldn't know that, which predisposes them to get these sleep pattern disorders.
Okay, thank you so much, moderator.
Yes.
First of all, what we need to understand is that we have spoken about the advantage of sleep, but also I spoke about adequate time for sleep. Adequate time for sleep, doesn't mean that excessive sleep or too little sleep, but just adequate. So if it's too much, it's bad. If it's too little, it's bad. So before we go in for those other activities which people can do, which can cause disturbances in sleep, it's very important for us to also appreciate that if we are disturbing our sleep, the significant parameter which we shall be based on is we want the outcome should not be that we are having limited sleep or we are having too much sleep. But we need to maintain adequate time for sleep. Because if you have also too much, we shall see how it will also cause you another issues. And your body, you are every time keeping it low in the activities always low, the activities always low, and now you understand also low level of activity. Now if you have the series or a body event which requires the body now to be very which stresses up the body actually, so you find out that your body cannot manage that very well. For example, disease process and so on, because your body has all this, your body cells is more of that being dormant. So there are very many occasions or very many events which individuals can be involved in or which can cause a series of sleep disturbances. One which I will put very, very clearly. Certain medications, there are medications which are prescribed in the hospital, so, which may be having side effects of that. But also, if I speak about medication, by the time they prescribe for you, they will tell you and know how to manage it. You will be aware of it. But there are these things which we also take, the drugs. And the drugs, you'll talk about then caffeine and what. So you'll find out that those are chemicals. They contain chemicals which interact up with your body makeup, and they will be able to interrupt your sleep by affecting your brain functionality and the chemicals which come out from the brain, which are natural. So you will find out also other things like people who engage in exercise. Exercise is very, very good, but excessive of it in such a way that it will make you too tired. It may not be necessarily exercise or even work. Anything which makes you a bit too exhausted and may end up to be interrupting your sleep patterns in such a way that you will either have longer time for sleep or limited time for sleep. Also, lack of exercise. You'll find out that you are there, you are lacking exercise each and every time. Lack of moderate exercise. So you'll find out that your body cannot cope up with adequate sleep, because there is a way exercise makes up your body, train up. There is that need for that minimum exertion or some moderate exertion for you to be able to catch up sleep very nicely. Then also you find out that other things like stress, and this one here we have to capitalize it. Stress is rampant, is everywhere. Every person is having a given cycle of stress and so on coming from various patterns. But the most significant part of it is that it's affecting our quality of sleep. That issue of stress can also be anxiety. You are very anxious. Sometimes you are anxious because of a positive thing which has happened, or you are anxious about a negative thing which has happened, but all the same you are anxious and you cannot maintain up a sleep. Sometimes you are depressed about a given process which has happened, all those things, or even a medical condition, like a medical condition which has come to you and you cannot maintain yourself. And very commonly, most of the times in the hospital there we find out clients with sleep disorders the very important part of it, which we shall understand, is that they are always diagnosed with the mental illness. So sleep disorders is a neurological. Most of the causes are neurological, and you find out that if neurological means that affects up the brain, and now if it affects up the brain, it means that you have also high chances of having other brain disorders, which we shall call psychotic disorders or mental disorders.
Okay.
Thank you.
All right. So actually, maybe now to compliment Mr. Simon, I had a friend. He got an accident. After getting an accident, actually it was in his early teen years. The guy told me up to now, like as he's sleeping, he gets those experiences like as he's getting an accident again, and he just jumps out of his sleep. Also, could it be like those post-traumatic stresses could cause these disturbances?
That's very, very true. Yeah. In some cases, you find out that, and even before you go to post-traumatic, even the more you thinking over, if you have had an experience, even bad or good, but for as long as you keep it in the brain for a long period of time, the brain stores it, and for as long as you keep on thinking on it, it becomes, it will dominate.
Yeah.
And if the experience, for example, for that same case, the person has had a lot of experience which is too nasty, which is very bad, that's also very, very common. Post-traumatic stress is very common. Any kind of trauma, be it accident, be it the trauma to yourself, which causes stress and so on and so forth. Excessive stress, anything which will injure you very, very much, which will make you to retain, anything which will make you to retain up a given memory for a long period of time, and in the greatest sense, it can turn out to interrupt up your sleep. And also, the .com children over being on phone and so on. That one, the research has shown that it has very significant value on disturbances in sleep and television and so on. Those nice.
Okay, all right. Thanks very much, Mr. Simon. Indeed, it's exciting. Hope other viewers, you are getting to note of these things you could do which could expose you to get sleep pattern disorders. And it's going to take us through also some of the challenges or you can face due to these poor or bad sleeping habits. Now, maybe I come back again to you, Mr. Simon. Do these sleep disorders have types?
Yes. And what I can experience may not be the same as what the other person is experiencing. Clients have been coming to the hospital presenting with different types. Some of them don't know that I'm having sleep disorder. Someone just comes, but now they come with the side effects. Then if you take up history very well, you find that actually this is the effect of sleep disorder. Yeah, there are very many types, but the common one, we shall have here we have insomnia, we have restless leg syndrome, we have narcolepsy, and parasomnia. So we shall have to speak about each in case whatever. If maybe we start with insomnia. Insomnia is just as simple as difficulty in getting sleep and difficulty in maintaining sleep.
Okay.
Yeah.
So like it's not easy to fall asleep and also it's not easy to wake up.
Yes.
Okay.
It's not easy to maintain that sleep.
To maintain that sleep.
Yes.
Okay.
Yes. So you find out that there is excessive need for you to be awake. So that is insomnia, and there's very common, of course, the causes which I speak about. The general causes, the stress, the anxiety, depression, whatever. You are on the bed and you are just there. You cannot even fall asleep. You're trying A, B, leg up, or down, what, nothing. And once you've got it like this, again you are awake, something like that. So that is it, insomnia. Difficulty getting sleep and also maintaining sleep. Then if we went to restless leg syndrome. Restless leg syndrome, this one, just like it goes, this is characterized by excessive urge to move your leg. At least once it comes, at least you move your leg. That's when you really have it resolved. And it's very common in conditions like these diabetic patients here. These patients always have tingling sensation of the leg.
Like what are you trying to mean by tingling sensations? Yeah.
If a diabetic patient is there, they know it very well. That's what they normally run up with. They say, my leg is as if there is something there. So you feel there is that feeling of uncomfort in the leg, as if we could say someone is breaking it or something like that. So restless leg syndrome always occurs. It's more prevalent at night, and now that's how it will impair your sleeping at night. So we find out that it's worsened by being inactive or reduced level of activity more so at night. Then it gets relieved with the increased level of activity. Maybe if you're walking and so on, you find it's relieved. And for that one, the major cause is changes in the chemicals of the body, which is basically the dopamine, which comes from the brain. And the dopamine is the one which maintains now the body's activity, the body movements. And in very many occasions, we find it common also in patients who are having iron deficiencies, because we find that iron has a significant relationship with the levels of dopamine. Low iron level, we find that it will also result into low dopamine levels. And of course, in cases when we find low levels of iodine, like during pregnancy, they might also have restless leg syndrome. But all this we are speaking about, they are there, but and you will know how to counteract it as we continue. But there should not be something which is worrying if it occurs for some short times. You will just know how to manage them. But it becomes significant if it's chronic, if it's persistent. So that's restless leg syndrome. Very inconveniencing. We also have another one called sleep apnea. So apnea is just difficult in breathing. So sleep difficulty in breathing. So this is where an individual is sleeping and all of a sudden is stopping to breathe and again regains up sleep. And again regains up breathe like that. So there is a intermittent stopping of breathing and regaining of breathing. This occurs in a recurrent manner. And you find out that that's very dangerous in such a way that you are not taking in enough breath, and you are causing a lot of tension to your body. Because as you're not taking up enough breath, you are also not taking up enough oxygen, and definitely you will find out that what we call compensatory mechanism will set in. Compensatory mechanism are these strategies which the body employs to correct a given state of the body. Like if you're not taking up enough oxygen, the body will not have enough oxygen, and therefore it will compensate or it will set in strategies to obtain adequate oxygen in the body. So that one, as the body is trying to compensate all those strategies which will bring in, it will also work at the expense of its own integrity. So the body's integrity will also be lowering. And as the body's integrity is lowering, you will realize that conditions will set in, for example, conditions involving cardiovascular system like hypertension, like increased risk for stroke, and so on and so forth. That is sleep apnea. Now the causes can be what can just be, and the signs of course here we find out the first thing we have seen, breaking of sleep in the middle. You breaking of breath in the middle, and you regain it. You continue breathing, you regain like that. If it becomes significant enough, it can have health burdens. Then also, you can have people who over snore, and someone is snoring. That's also very risky. In when I was really young, found out that if you snore at home, my dad will wake up and tell you, you can change him. He's sleeping badly. Go and check, which is very vital. The position which we use for sleeping is very vital. If a child is snoring or a person is snoring, let us try to turn them a little. They may stop snoring because they are breaking up their body, what we have just said, and they are taking up limited air, and so limited oxygen in the body, which will cause further stress to the body and predispose the person to health risks. So that's another one which is very vital. That is sleep apnea. So you will find the person is snoring, and then in the morning the person wakes up very tired, is weak, fatigue, headache, so on. So those are all things. Meaning the person has done a lot of work at night against limited oxygen in the body. And sometimes also sleep apnea can occur for people who are obese. Some people with excess body weight. So you'll find out that there is a lot of deposition of fat tissue on the airway, such that the airway is compromised. The size of the airway is compromised, is reduced, and there is a limited intake of air, or sometimes even there is intermittent collapsing until a consciousness is brought to person when the person can then regain.
Okay, all right. Thanks very much, Mr. Simon. Indeed, it's educative and bringing concern to the public and the societies. Hope other viewers are getting to note all these types of sleep disorders he's taking her through. He took her through the insomnia, like difficult to get into sleep, and also he told us it's difficult to maintain sleep. He took her through the restless leg syndrome. He took her through the sleep apnea, and he has taken her through the snoring. Let's first get into a short commercial break, and here in the next segment, you should not miss out, he's going to explain to us indeed how does this snoring come about, and also he'll take us through other various types of these sleep disorders, the prevention and the complications which may arise in case you don't manage or you don't seek attention to solve these sleep disorders. Thank you very much, other viewers. Let's get back.
West Nile TV, lighting up the region.
A brand new Global Star TV with StarTimes Inside Technology. New TV innovation with an inbuilt decoder that connects you to both StarTimes antenna and satellite signal. With StarTimes Inside Global Star TV, you can enjoy over 300 local and international channels, 1 month StarTimes highest bouquet for free, automatic system update, more benefits, more affordable. StarTimes Inside Global Star TV is available in all StarTimes branches and dealers countrywide. StarTimes Inside, entertainment inbuilt.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break. It's still the Daktari Show, a health educative show which airs here on West Nile TV every Thursday from 10 a.m. to 11 a.m. where we bring you doctors, nurses, dietitians, dentists who come and educate our viewers on matters regarding health, on how to live healthy, good lives, which will also help to reduce expenses. And today we have Mr. George Simon, who is taking us through sleep disorders, because people outside there take sleep as just something mere, but this sleep can affect your entire life, where it can kill your mood or it can give you a good mood. So today he was taking us through the sleep disorders. So in the first segment, he took us through the sleep apnea, he took us through the insomnia, which is the difficulty in sleeping and maintaining sleep, and he also took us through the restless leg syndrome. Now he took us through also snoring. Now in this segment, he's going to take us through how does this snoring come about, because people often in the community, you are already there, you have your children, or it could be the adults, they are snoring, you don't know how this snoring comes about. So he's going to take us through how the snoring comes about, and also take us through other sleep disorders. We'll be back from that short commercial break, Mr. Simon.
Thank you so much, Mr. Moderator, and back to the viewers. Thank you for coming back for this other session, the next segment. Yeah.
So who can pick on how does snoring come about?
Yeah, thank you. We were speaking about snoring. We had a hint on it in the first segment, and here snoring, we shall again capitalize on it. Snoring is a very common thing. We at least in a family, you have at least, if not one child can have, you can find that is snoring. So we cannot take it for granted. And how it comes about is that you'll find that you'll find that it's just a vibration. It's just a sound of vibration of body tissue. And now, of course, the tissue which is volia is the tissue of the airway, of the some people call it the windpipe and so on. So that's just how it occurs. That's when it's vibrating, and how it can be vibrating. What can cause the vibration to take place? It just now means there has been a narrowed. It can be due to a narrowed airway in such a way that air will be forcefully passing through it. In the past or during your daytime, or your airway is okay, is wide enough, then at night you find that it has narrowed, and still you have to maintain up the body cells with the given oxygen. So you will be taking in air but moving against the resistance. That's how it can cause the vibration. Or also in case there are. And another thing, Mr. Moderator and the viewers, that all these sleep disorders which we are talking about are more common in children. They are more common in children, then they keep improving, or sometimes persist in some individuals as they grow up. So, and another condition which is very common in children is what we may call tonsillitis, inflammation of the tonsils. Tonsils are found on the sides of the mouth, at the back of the mouth. You will find their tonsils. So sometimes in case you have infection, bacterial infection, you will find out that it is enlarging up and moving towards each other to close up the airway. So in such a case, air will be moving against the resistance of these tonsils, and it can cause the vibration, and the sound now comes out. And I hope we all understand how snoring occurs. What snoring is. That sound of when someone is sleeping, just as simple as that. So that's another thing, what we can call tonsillitis. Maybe an infection or a response to infection can cause that. Also, sleep position is how someone is sleeping, very, very important. That's why I told you the other time that my dad would go and tell somebody, you go and turn him, you go and turn him. So if we found out that if someone is sleeping on the back, there is high tendency for the tongue to fall backward. And as the tongue falls backward, it will be closing up the airway, and the vibration will be taking place against resistance of the tongue, and something like that. Maybe I also highlighted there that time now obesity, high deposition of fats along the throat muscles, which will be narrowing it up. Sometimes we just, in case there is a neurological condition, maybe sometimes these sleep apneas come from of neurological origin. It starts from the brain, such that there is a limited or impaired control of breathing by the brain, because you know that all activities taking place in the body are coordinated by the brain. So that coordination by the brain can be impaired, such that breathing is not okay, and also the muscles of the throat are not coordinated well, and they can end up collapsing. Something like that.
So that's how snoring comes about, and there are those abnormal sounds when someone is sleeping, like those hoarse sounds.
That is it.
Okay. So now, sir, like, are there other types of these sleep disorders our viewers could be, like, you could let our viewers know?
Yes. So another one which we shall have, we have so far done two.
Insomnia.
Sorry, we have so far done three of them. Insomnia, sleep, and restless leg syndrome. Then we are going to the next one, which is narcolepsy. Narcolepsy is the cause of it more so is not known, but has a genetic origin. This is now where the person has excessive urge and uncontrollable urge, which culminates into sleeping. You have excessive urge to sleep, and more so during daytime. You have that excessive feeling of sleeping, and in most cases, even you find out that you'll be in the middle of your work, you are very busy, very active, doing something, then all of a sudden you fall down, you are into sleep. That's what we call cataplexy. A condition where suddenly you have generalized body weakness, generalized loss of muscle strength, and all you can do is to sleep. That's how serious narcolepsy can be up to. So that's all, and it's normally during, you find out that you are excessively sleeping during daytime, every time sleep, 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 sleep. And if you don't sleep, it's something else. So that is it, narcolepsy. And of course we realize now that it can affect also the patterns of now night sleep and so on, and even your own quality of life during daytime. Something like that.
Because most of the time you'll be sleeping.
You'll be sleeping. You can't work. You are every time sleeping. Then we can see the next one is parasomnias, and this is now the most the one which I say touched my life when I came to encounter the various patients and so on, with a lot of myths and misconceptions, communities misinterpreted like nothing. Parasomnias, these are just abnormal behaviors which are associated with sleep, and it ranges and is person specific. It can vary from individual to individual. Like one, you'll find out that someone, it can be someone is walking while sleeping. That's what we call sleepwalking. You can find out that someone is talking while sleeping. That's what we call talking. Yes.
There are beliefs in the communities, like those things are related to rituals.
That is the challenge which we have consequently very many times found, and it takes time to explain that to someone that ideally these are things which are medically diagnosed. These are conditions which are medically found. And of course, you can associate them with whatever you're associating them, but also we need to appreciate the fact that the more you concentrate up your mind with the such beliefs you are having, the more you increase the susceptibility of having it, of having these sleep disorders. We shall see it more. So you find out we have said there is sleepwalking, sleep talking, sleep eating or chewing. You find someone chewing. We have sleep, bed waiting. We have paralysis. So let me try to dive into each of them.
Yes.
In sleep walking, this now where someone wake up all of a sudden, and it's very common. Can be genetic, and most common in children. Someone wakes up in the morning, in the middle of the sleep, is waking up, going to the kitchen, cooking, opening up the door, going out, doing any sort of thing. And most interestingly, if you ask such people that, what are you doing? What were you doing when you were asleep? They cannot tell you. They are there. So that one, you find that and they are doing it over and over, and then it becomes significant. And so that is sleepwalking. Someone is walking, but he's sleeping. Doesn't even know anything, but he's sleeping. That is a parasomnia, which becomes significant and needs medical attention in case it is persistent. But it's more common in children and resolves as the person grows up. Then we have what we call also sleep talking. Someone is talking, sometimes even you find they are speaking in languages which they even don't know. It is even possible up to that extent. Someone is speaking a lot, they are in a conversation, they are doing this, they are doing this, they are doing this. If you ask them, what were you saying? They don't know. If you wake them up, they have woken up as if they have been in deep sleep, they don't know anything. That is it. Sleep talking. Then you go to chewing. Now this one I want to give you what happened. There is a couple who found out that their marriage was almost breaking up. The person said that I'm tired of this. It reached us following a community quarrel and need for divorce. That this man here is every time eating in my ears. Is every time in my ears at night and talking a lot of things. This might be issues which he is solving with his ancestors. So you find that, but so the person is very scared. The woman is the young lady is very scared that this could be a misfortune. This could be something which is targeting her. This could be something which is not meant for her husband. Therefore, that husband is meant for someone else.
So they have to separate.
They have to separate to find out that let the person first solve out the issues with their ancestors. So to that woman, we emphasize that this is something which is normal. We brought out the articles, we brought out everything, and explanations to make the person believe that this is normal. And we had interventions to help this couple come back into normal. But it was for that case, it persisted up for that man up to that level. Could eat at night, eating, talking, popcorns, what, all sorts of it. Yeah. So that is sleep talking. Then we go to sleep paralysis. Sleep paralysis is now where you are sleeping, and maybe an event occurs that is normally happening when you are about to wake up a little. Then you are awake, and you are getting awake, yes, but you cannot do anything. Your body is paralyzed.
You feel like you're weak, you can't move the legs. You want to move the body and do, you want to turn, you cannot. So that is parasomnia, and specifically sleep paralysis. That is medically diagnosed in case it becomes chronic. So it's there, and it can cause a lot of issues to families, to person. It's obvious that this time around I slept, but the Satan was on my neck like this. I could not even turn like this. Can you imagine? So they come saying all such things. So that is sleep paralysis, which our dear viewers, you have to quickly pick it up. That is not anything related to Satan. It's not anything related to something which is targeted to you and so on. That is a sleep disorder which can be diagnosed medically in case it is what? Persistent. So that is
that bedwetting, someone, of course, you will say that bedwetting is
Even when you are old.
those children. But as you grow up, we expect normal body development to eliminate bedwetting. But if it becomes persistent, of course, now you will have issues.
Okay.
So you can come to them. You can, in case you have any of those conditions we have spoken about, we are going to see ways of harnessing them, and also in case you cannot harness them like that, you reach out to medical personnel or any hospital next to you, such that you helped out better.
Okay. All right. Thanks very much, Mr. Simon. Indeed, it's educative. Hope our viewers also enjoying this session. Now, maybe to ask, already you have these types of sleep disorders. Some actually they are presenting by their names. Are there some general signs and symptoms which people in the community there can see and they get to know that this could be a sleep disorder? I need to go to the hospital and seek medical attention.
Yes, thank you for that wonderful insight. And now, just like we've been saying, we have spoken about a lot of various sleep disorders, and I've been mentioning it very seriously that if you experience any of the signs or symptoms, any of the signs or symptoms, of those complications we have been saying, so you need to, and it's chronic and it's persistent, and you are doing what you can to avoid them, but you cannot, just like we shall receive ways of overcoming them a little. If you are doing all the interventions you can do at home there but is failing, then you need to go to a medical personnel or to a nearby hospital. For example, you are having the signs, of course, which we have been speaking about, all those ones, difficulty falling asleep or maintaining sleep. You are having a lot of night terrors, nightmares. By the way, I didn't speak about that. Nightmares also is a sign of is a type of parasomnia. You're having persistent nightmares. Nightmares which here now after the other, now after the other, now after the other. Very dangerous one. Persistent, something which can cause significant damage to your mental health, to your productivity, and so on. So, and also accompanied by those challenges which you can see, you find the sign, and you find when you wake up, you are feeling too tired, like you are feeling you are not rested. You have not had enough rest. And during daytime you are very weak. Some will call fatigue, and you are feeling like you are needing to have more rest, or else during daytime you are too sleepy. For example, in narcolepsy, you want to sleep, or else you have not had enough sleep at night, maybe insomnia and so on, and yet you like to now compensate up, and so on. Once you find out that this is something which is continuous, then don't sit on it, and go to the nearby hospital or health facility and get an intervention. And you ask up to them for help in such facilities. I think something like that.
All right, thank you very much, Mr. Simon. Hope our viewers have gotten to note. In case you get any of those signs or symptoms, immediately rush to the hospital. These health workers will be there to attend to you and help you overcome these sleep disorders. So generally, how can people in the community, how can our viewers, they have gotten to know how dangerous these sleep disorders are? How can they prevent them?
Okay, thank you so much. The ways of preventing the sleep disorders are very diverse. And of course, you need to first of all dig into and understand it. The way you will prevent it will also be in line with what the cause is. Yeah, there are those which you may not do much yourself, but you need a medical attention. You will also have to do that. There are those which you just need to treat their symptoms, and you will also have to do that. But those which are very obvious that may be caused by excessive exercise, too much of it, and excessive exhaustion, too much work during the daytime, you are overbreaking out your body, so you will need necessarily to reduce up your level of exercise and to moderate, not again to pull or none. You need to reduce it. Just you are the one who knows what your moderate is. A moderate of someone may not be more moderate of the other, but you will know that this is exactly, I'm overstressing. There are people who even say, but I'm overworking up myself. So once you can even realize that, then you will be able to at least try to lower. Then also, you need to engage up in exercise. In case you don't do exercise, do moderate exercise, such that you can have your time to sleep. Well, then also issues, if it's caused by you are too much into your sleep late, it is a routine thing for you to sleep late, you are all of a sudden in your phone and so on and so on, or maybe talk about TV and so on. And you are, because now very common about kids every time now that they are in holidays. TV, TV, what? So parents, dear parents, you can help out these kids. You regulate up the time they sit down for this TV, so that they have enough rest. Maybe by 10 p.m. so that all people must go to bed. Or then maybe by the time you say all people go to bed. Then when we are done with that, you can also have yourself relaxing up yourself, no stress. Look for ways of managing your stress. And avoid stressful situations. Next time, maybe Mr. Moderator Sand, you ought also have a separate package on stress, because it's also very, very important. So stress alone, let people know how to manage their stress and avoid stressful situations, because they are the ones which will, of course, keep you thinking, you don't be anxious, you don't be too much depressed. And if you know you have a medical condition like psychotic condition, mental illness, at least you go up you adhere to your medications and go after going for proper diagnosis. And you help up also your relative who are having it, sign that they adhere up to medication. And you also let your body, when you're going up to bed, you let the body get to know that we are going to bed. You don't all of a sudden, you are from exercise running up and down, back you are on bed. So you can set up a routine schedule or timing of how, or a style on which you are going to reach your bedtime, such that the body is prepared enough, such that when you are going to bed, you are just gone. And I avoid, of course, taking up these things, the weed, the chewing of weed or what.
There's drugs, the cocaine, marijuana.
Some people take energy drink and then they now get up. Someone has taken stain and is now.
Whether even some take coffee, these coffee seedlings.
You take coffee seedlings, you take coffee in hot water, and you find out that you find a lot of efficacies in your sleep. And also manage your medical conditions. If you have medical condition, adhere to medication. That's very, very important.
Okay. All right. Thanks very much, Mr. Simon. So it's almost coming to the close of the show. Are there some complications someone can get due to failure to manage these sleep disorders?
Very, very many. Of course, we have explained out. We shall range up from advantages of sleep. So those which impair sleep will just bring out the reverse of the advantages of sleep. Okay, so the complications are there. Could even those who have it can, because we said that sleep is important in such a way that it helps you to balance up your hormones. So if you have limited sleep, you will have high chances of having cardiovascular disorders like diabetes, because there are insulin will not be regulated well. There will be high levels of insulin every time, and also you find out the body, even the growth and development of a child is not going to be okay, because now the cells are overstressed too much, and because of no adequate sleep. So you'll find out that your mental capacity alone will be impaired because you are not giving brain time to recover and consolidate memory. You'll find out also that we are talking about you are stressful life, even the complications which you are having will worsen.
Yeah.
Even medication which you are taking may not be able to work out for you. So try as much as possible to manage your sleep disorders, either at home or you go to the health facility in case home management is not adequate.
Yes. Okay, thank you too very much, Mr. Simon, for giving in your time and also educating the viewers on the preventive measures, also on these various types of sleep disorders. Indeed, it has been educative. Hopes also our viewers, you have enjoyed this session. Maybe you can give in your conclusion remarks as we end the show.
Thank you so much, Mr. Moderator, sir. And I would like to appreciate the viewers also for your time and for watching Daktari show. It's really very important to know about your health, and of course now with the aspects which are being covered. And I would like to encourage all of us to keep watching Daktari show, West Nile TV. And my dear moderator, sir, I also appreciate for the opportunity you have given me. Let us manage sleep disorders. Let us take sleep as the first medicine. Sleep is medicine, and medicine, once you take it in too much, is bad. Once you take it in little amount, is also bad. Medicine has to be taken as prescribed. So the prescribed time for sleep, the adequate duration of sleep is very important. If you are not meeting up that adequate time, just know you need an intervention. So I would like us to end here, and thank you so much. Back to you, Mr. Moderator.
All right, thank you to Mr. Simon for giving in your time to come and educate our viewers of West Nile TV. We know you're a man of busy schedule, so giving in your time to come and educate our viewers, we don't take it for granted. Also, we thank our viewers who have been with us from the start of the show up to the end of the show, and we appreciate you always giving in your time to watch this health educative show. And we salute you and wish you all the best of your day and a morning. Thank you very much. Blessed day. And also blessed day to our producer, Mr. Elliot. Thank you.